I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsors, Viatris and Vertex, for their support. Today we are joined by two remarkable leaders whose work is making a real difference in the lives of patients and communities alike. Mike Walters is a true pioneer in pharmaceutical business and innovation, bringing nearly 4 decades of experience to the table, and his career began at Johnson & Johnson, where he spent 14 years in leadership roles across sales, marketing, and management development. In 1996, he launched his first company to help organizations navigate product commercialization in the U.S., and Mike's impact on the field of cystic fibrosis is profound. As you will hear, he founded and led Source CF, MVW Nutritionals, and CF Global Services, playing a key role in bringing many standards of care treatments to market. A Vanderbilt graduate with a degree in biochemistry and chemistry, Mike combines scientific insight with a deep commitment to innovation in rare disease care. And joining Mike is Jason Vandiver, Chief Operating Officer at MVW Nutritionals, a proud Alabama native. Jason earned his BS in finance from the University of Alabama at Birmingham and spent 16 years in banking before joining MVW during a period of rapid growth. And he now helps lead the multi-million-dollar family-owned company that's become a global leader in nutritional products for patients with CF and non-CF EPI. And beyond business, Jason is a passionate advocate for civic engagement. His leadership in fighting childhood food insecurity includes roles with the Food Bank of North Alabama, Family Services Center, the Care Center, and Alabama Possible, where he currently serves as board chair. And I'm just thrilled to have these two men who are doing so much in the CF community and elsewhere to join us. So welcome you both, Mike and Jason. It's just fantastic to have you both on this podcast. Thank you.
Glad to be here.
Our pleasure.
Tell us about MVW Nutritionals and what you're most proud of.
Well, I think the best place to start is really a conversation I had with our other founder, Melanie Vanderbilt. And when we started this organization, I turned to her and she was really the catalyst, because we had a number of calls from the CF community. There was a concern about, access to multivitamins. And after multiple times saying, Melanie, I just don't think so, she convinced me that this was something important to the CF community. But I cautioned her. I said, Melanie, understand that this will be probably no more than a philanthropic venture. And I have to smile because today, through our Patient Assistance Program, we call it PAP for short, that's exactly what we're doing. So it's sometimes, and maybe I'll say through default, that we really have arrived at our mission.
That is fantastic. And I wanted to follow that up with what you have both done for the cystic fibrosis community. I've been to Egypt a couple times now to meet with those cystic fibrosis families. Just got back from Egypt, actually. And I remember the first time I asked you, Jason, if MVW could donate vitamins. And I thought, well, who am I to ask somebody to donate their vitamins? But, Dr. Nasser was so hopeful, we really need the liquid vitamins. It's like gold there. They don't have any access to this. And there's so many malnourished babies there. I mean, first of all, tell me what you were thinking and why you just donated right away and allowed us to take those vitamins to Egypt.
I'd probably say, Laura, we try to start at a yes. I mean, we don't like to start at a no and work our way to a yes. We like to do the inverse of that. So if it's something that's within the bounds of what we're capable of doing it, we're really going to make an effort to make it happen. whether it be domestically in the U.S., into South America, into the Middle East, we've always had pro bono bottles that go out for a variety of different reasons. And so this one felt like it was just the next chapter. I'd gotten a chance, I think, to speak with you at a couple CF-specific conferences, perhaps even meet Dr. Nasser before the connection was made prior to her original trip to Egypt a few years ago. But probably just because it felt like living out the mission. It really wasn't anything more complicated than that. It was just something that was within the bounds of my authority to say yes, and I like to bring smiles to people's faces, and I know that we accomplished that. So.
Well, and I'll never forget the first time, Mike and Jason, that I took those liquid vitamins, handed them to Dr. Iman Fauda, and she said, "Welcome to Egypt, 1 minute." Took those and right away gave those vitamins to the infants that needed it desperately. And then she came back and we got you some pictures and more pictures. We'll get more pictures because you donated more so that I could take them to Egypt again. But Mike, you were going to say something. Go ahead.
I think, Jason used the phrase within his authority. I think we get calls every day. We get calls from families where the product shows as having arrived, and yet it's not on their doorstep. We have people, particularly during COVID, where they were between insurances. And I think that the heart of the company is everyone here knows when they get a call and someone says, can you replace? Can you help? The heart and spirit of the company is, to Jason's point, we start with a yes. We absolutely start with a yes.
And I have to say, you're definitely friends. I mean, we're all friends now. We're not just in the same kind of business from different aspects of the disease world, but I definitely consider you my friends. I have learned from both of you. I trust you. I appreciate all that you do. And I always do tell people, especially lawmakers, if you don't know somebody with a disease,
right,
you will. And that brings me to you, Mike, because you've been wonderful through everything you're living with, and your wife, who has so many, you both are going through a lot with her cancer. So if you wanted to talk about that, you have a definite cutoff time in this podcast to care for her. So I thought, since you're not only helping rare disease and then you're living with disease, it was important that you share your story as well.
Well, first of all, let me say that the absolute greatest message we got, several months ago, is she's in remission. She had to go through a stem cell transplant. We spent 8 months in Houston at MD Anderson. And I have to smile because MDA was our choice through the counsel of a very good friend at the CF Foundation. So we were looking at a lot of different institutions, and he said, "Mike, have you looked at MDA?" But it was the way he said it. And we went down to MD Anderson. She underwent stem cell, and she's in remission. Now, will she ever regain the stamina that she had? No. But she shared with a friend the other day, she said, "My doctor here in Huntsville gave me 2 years without a stem cell. And we are past that 2-year point." So the fact that she and I are sharing a life together and spending time together is a gift. It's an absolute gift. And I'll tell you, going through, her particularly outpatient and the struggles that we had with, pre-authorizations and medication being in the pharmacy, and whether it was specialty or retail, co-pays, it actually gave me a better insight for what every family and every person who has cystic fibrosis goes through. So, she often says, you're always looking for the bright side of things. And I'll tell you, if there was a learning and if there was something that came out of her cancer that I would never have experienced, It's what every person with CF goes through each and every day, just on the medication side. And I think it's given me an empathy I never would have had.
You're so empathetic, and have both of you have always been before this, and I just appreciate all your honesty and knowledge and everything you do for the CF community, while you both definitely have your own lives with, different challenges. So thank you. I wanted to, you know, continue on from all the help that you have given us in Egypt by donating vitamins to any path that you want to take on this podcast, Mike. But I also wanted to talk about the partnership with the Bonnell Foundation. I was really grateful, Jason, that you called me and proposed that we work together because funding was discontinued by Healthwell for many different reasons that we can talk about. But if you want to kind of lead us in that discussion, Jason, of how we, started working together.
Ooh, it feels like we've been doing it now for months and months, but the formal relationship's only been, several weeks. But it became apparent to anybody that was really listening, if you kind of imagine your ear to the tracks analogy, that at the end of 2024, there was some change afoot with Healthwell, and we were seeing the vitamin and supplement fund pausing for longer periods. We'd already experienced the vitamin supplement fund maximum allocation be reduced on a couple of separate occasions. But then obviously the disheartening news at the end of 2024 that was later confirmed in early 2025 that the fund really was not going to be a viable option for people in 2025 because of the loss of most of the primary funding. So early conversations really came out of centers like Vanderbilt and University of Tennessee, University of Louisville, University of Kentucky, many of which are regionally close to us, and they were clamoring for ideas. I have a small desk here that my laptop and my computer sits on, and I have stacks of business cards, and for whatever reason, Laura's card was always near the top of the stack. And so I started thumbing through that stack of cards and said, who's going to be the other mad scientist in the lab with us? Because we're going to have to get really creative on how this is going to work. And the initial call with you was very much like a lot of the calls that we get from patients and from centers needing assistance, which was you started at a yes, right? Laura Bonnell and the Bonnell Foundation started at a yes. And then we just had subsequent calls to figure out how we turn that yes into a formative plan. But we knew that we thought we knew, I'll be honest with you. We thought we knew what the implications were going to be for the loss of that funding. Our suspicions have been, confirmed, but really confirmed past the point of any depth that we thought this impact was going to look like. We get calls daily. I would be shocked if members of our team aren't on the phone right now in another room fielding those calls. But we knew we needed a partner. We knew we needed a partner that had a really solid reputation, as you do, to help us not only kind of get out of the regionalism that we were trying to operate in, but to help give us a platform similar to the one that we're on today to get the messaging out. Because we were, 4 months away from the second largest national gathering of cystic fibrosis staff members. We were 9 or 10 months away from the largest one, the NACF meeting out west this year. So we knew we couldn't wait. We knew we had to do something quickly. And thus this bond was formed.
It's been great. I mean, our board member treasurer, Patty Yeager, she really, with you, just went full speed ahead and your team and made this work. And Unfortunately, we couldn't fund the entire thing. We
Sure.
took our section, of 15,000, which I think we've already spent now at this time, unfortunately. Um, but it's been great to be able to help, some of these patients who definitely need the vitamins.
Laura, if I could jump in here, because you were the catalyst, you were the spark. And when I came in yesterday, and we've had a number of different examples of how people have followed your leadership, the Bunnell Foundation's leadership. But yesterday I heard that there was a fundraiser at Wake. So the center had a fundraiser. And the money they raised, they provided patients who otherwise could not afford vitamins a gift card for $49. And we had 3 people call in just yesterday. And the dietitian called us, fortunately in advance, to explain what they had done, and said expect a lot more. But I think an important theme is, central to your leadership. The effect of the Bunnell Foundation is not just $15,000. It's far broader.
Yeah.
Yeah. Jason, maybe you could talk about Judy in Colorado, or, the center in Pennsylvania that approached 2 different state funds. I'm working with UAB right now to try to look at a coverage footprint. I mean, so it's, it's not just $15,000. It's far broader than that.
Yeah. Mike's 100% right. I mean, I had several conversations that would start with something like, we want to do something similar to what the Bunnell Foundation is doing. And so that immediately perks my antenna up. So I think the first one that came about sometime in early March, if I'm not mistaken, was Judy Fulton, who's a long time, very well respected dietitian out of Aurora, Colorado, said, we need to do something here. We understand that you guys are stepping to the plate with a price that is, from a profitability standpoint, I laugh because the thing that gets me really going is finances. But, but we need to do something. And they luckily had a benefactor. They had a gentleman whose son has cystic fibrosis and had received care at the hospital there in Aurora, and had a small nonprofit. They did a golf fundraiser, a couple other things. Down for a Cure, I believe, is the organization. He said, we have set aside some money, and we want to effectively prepay for vitamins that are being, funding is being lost for vitamins for these patients in Aurora. And of course, we started at a yes, and then just kind of had to formulate how that was going to work in our system and within the bounds of our staff and our accounting practices. That was really the first one. The second one was a center in central Pennsylvania came forward and said, hey, again, we want to do something similar to what the Bunnell Foundation is doing. We need to step to the line here. And they said they had some state funding that was earmarked for patient assistance, and would we honor the pricing that we had laid out in our PAP if they utilize some of those state dollars to alleviate the financial restraints of the patients and their families. And again, we said yes, and just had to figure out how to make it all work. But yeah, the $15,000 number that you threw out there, Laura, I mean, that's 75 families, 75 homes, children often, that don't have to worry for the next 12 months if they have to choose between their vitamins or something else, right? Vitamins or fill in the blank. But Mike's right. The ripple effect of that is something that's going to be really hard for us to really get our arms around. And it may take an NACF or 2 before people really start to realize that, we will be looking at this for years to come, and hopefully building a model of sustainability that can be, hopefully a complement to something like HealthWell, but not a full bore, replacement for HealthWell, because the scale is just is just not there yet.
And I really appreciate you saying that because it does make me feel better. I thought like, oh, we're just not doing enough. But when we do think about it as a number of families, it does bring the point across. And I'm going to make sure that we emphasize that moving forward, that we have helped so many people. And the other thing I just want to make clear to people listening is that this was in addition to what we're already giving out for financial assistance. We budgeted a certain amount of money that we give out to people for lung transplant grants and financial assistance, and then did this vitamin on top of that. So that wasn't budgeted in our year, but we thought it was critical and important to do. And then I also wanted to mention, because I think transparency is important. And like I always say, whether I have sponsorship from a pharmacy, or whether I get an impact grant from CFF, it's important to be transparent. So in my transparency, I just want to say that money, millions of dollars, was taken away by the Cystic Fibrosis Foundation from HealthWell. And that's how this happened. And I know, and it's important to say that because I do believe people listening will say, well, what happened to the money?
Right.
So, and that's kind of how we got started. And if you want to elaborate more on how that relationship goes, because we all have a relationship with CFF.
Right.
But it was hard to see that happen.
Yeah. I mean, I'll say this, and I think I touched on it when we were coming to grips with the loss of funding, because we had I think I shared with you, several thousand patients, a handful of thousands of patients that we were helping navigate their HealthWell dollars and have for the last 10 years. So for us, it was a huge impact, not only for members of our staff, but patients that we had cultivated relationships with over, the better part of a decade. So when we were looking at how deep the impact of this is going to be, I still think we're largely underestimating it. I know we've done a lot of great things. You've done a lot of great things. These other organizations stepping to the line have done a lot of great things. But I would say, I think to a certain degree, the Cystic Fibrosis Foundation may have underestimated the impact. They've put their Compass team, which is effectively their patient resource team, behind a lot of the call volume and inquiries that I'm certain they're receiving. I made the comment earlier in the podcast about our staff receiving calls. I can guarantee you, right now, somebody sitting at the CF Foundation is receiving calls about these very topics. So why they did it, Laura, why they chose to perhaps redirect those dollars is not something that's ever really been made clear to me, other than I'm sure in the larger, grander scheme of things, for a nonprofit of their scope and scale, there was some strategic plan that they were adhering to. But it definitely has been tough. I mean, I think there was numbers that I've seen, upwards of 8,000 patients that were utilizing those HealthWell dollars, right, to alleviate some of their financial constraints around vitamins and supplements. So when you talk about how many families, how many CF positive individuals there are in the United States alone, that number's in the 30,000 range. So quick math on that. I mean, we're talking about 1 out of every 4 people that have CF using those HealthWell dollars to supplement, the cost of their CF care. So again, why is still eluded me, but I know how we've responded. I know how you've responded, how others have responded, which has been extremely nimble and quick and patient-centric, all of which I think between the Bottle Foundation and MVW are core values that we share.
Yeah, and Jason, if I can build on that, I mean, I think there's always been a tension between the foundation and the funding that many researchers are wholly reliant on, that being the CF Foundation, between finding a cure and supporting those living with CF today. So I think that tension's always existed.
Sure.
If I look at the intention of that fund, when it was first formed. It really was a fund of last resort. And let me give you an example. We know, and the Health Well Foundation was very helpful early on in trying to identify, the number of total grants by payer type, private insurance, Medicaid, Medicare. And one of the things that sort of jumped out at me was there were people that could have participated in an enzyme manufacturer program. But instead of doing that, they were using funds from the Health Well Foundation. So as I go back and sort of look at this, my opinion, I believe that there should have been, and if there ever is, other large donors going forward, I think there needs to be a mechanism to gate, are there other avenues for people, and I'll use the example, for people to get their multivitamins. There are states where multivitamins are covered under Medicaid, and yet there were people using HealthWell dollars instead of going to their state Medicaid. As I mentioned, there were people who were taking enzyme, and every enzyme manufacturer has a very robust loyalty program. And as opposed to going through those programs, they were using HealthWell Foundation dollars. So I look at it, at least in part, as the original purpose of that fund that wasn't directionally where it was going. Now you add the tension of, directing dollars to, discover gene therapy and to find a cure versus potentially dollars that really didn't need to be spent because there were other avenues. I think that was probably some of the tension. And then, quite honestly, you throw us into this calendar year, and whether you are the CF Foundation or you're Laura or Mike or Jason, we all look at our investments and they're down, right? I mean, they're down. So now the foundation's even more challenged to fund the research going forward. So I think it's, and Jason touched on it, I think it's a very complex matrix of issues and questions. And the only thing I'll say is if a fund like that comes back, my opinion, I would encourage that there is a mechanism that serves as a gatekeeper. So if a person lives in a state and vitamins are covered by Medicaid, that's where they need to go first. If they're on an enzyme therapy, and every manufacturer has a program, and they have private insurance, and they are eligible, that's where they need to go first. And I think that would take a lot of tension out of the system, and that might encourage other donors to surface.
And I hear what you're saying, but I wish that, being the mothership of CF that they are, with billions of dollars, that they would not have thrown us into an emergency situation. Could there not have been more thought that would have alleviated this emergency? And I've reached out to Mary Dwight and Mike Boyle, and I appreciate their answers, but we gave them some solutions like, give us the funds, give all the nonprofits the funds. It'll be transparent. We can then go forward. We can work together to kind of solve the problem. So I appreciate what you're saying, but I think they've been around forever. There were better ways this could have been handled, and that they need to be as transparent as we are being. I feel like that's necessary, that they say, hey, here's what happened. Just want y'all to know we took $6 million out of HealthWell. It's thrown you into this situation. So now all of these foundations that are trying to help people can only do so much. So I guess that is my wish, is if they could have done something that was more transparent and that didn't cause an emergency situation and actually initially harm patients' accessibility, and then, it's all going to work itself out, but I don't think it had to be done in the way that it was done. And I also know that different CF families don't always know where to go.
Sure.
And unless the social worker is on top of it, which they 99.9% are on top of it, sometimes families don't know where to go, or sometimes they switch enzymes and then there's no vitamin program. And so that's also a challenge of everybody first goes to CFF because they don't know sometimes where other foundations like mine are. So they start with the big one. And then if the big one, CFF, isn't saying, hey, you can get help from so-and-so, or here's what happened, or here's a plan, I just think it's really important if we can all work together like we are, but that would include CFF. I think it would be such an easier process in my mind. I mean, I would hope that, then we could just like, oh, okay, we learned this from this experience, and now moving forward, we're going to make this, with or without Health Well, this plan of helping people better.
Yeah.
So that's my dream.
And I guess in the back of my mind, the question is, was the foundation expecting the Healthwell Foundation to share this information? And was the Healthwell Foundation expecting a donor to share this information? So maybe in all of that, that's why the communication didn't occur that you just talked about.
And a blame game isn't the point. I'm just saying a plan, because we're all trying to do the same thing, right?
And let me add, we're not in a static environment. I got an email, the first week of April, and New York Medicaid, effective the 1st of April, made a decision to stop coverage of vitamins and other nutritionals for those people over 21 years of age. So, I look at, the Healthwell Foundation as sort of one bucket, but then I see, the decision by New York Medicaid. So I don't think we're getting into a less complex or challenging time. I think we're getting into a more challenging time. And so to your point, how do we begin to find the resources? And I guess that's why I get so excited when I see the things out of Pennsylvania and Denver, and, hear the news about Wake, and, I'm working with UAB, and we're actually mapping out coverage.
Yeah.
What are the gaps? And clearly, if you're under 21 years of age in the state of Alabama, there's outstanding coverage.
Yeah.
Now, when you're 21 and above, there's not.
In Michigan, there is, because we have children's special health care. It's like different in every state, I know.
Well, and one of the things that I've been working with Virginia at UAB, and Hector sort of pushed us together in a very positive way. And I said, Virginia, wouldn't it be great if you put together an abstract at NACF? Or maybe there's a workshop, because there's a lot of new social workers. There's a lot of new dietitians, and they could actually use, a template like this to begin to understand, and we have a children's services group here as well. But in the state of Alabama, do they cover transportation? Well, actually, there is an offshoot of Medicaid that covers transportation to some degree. Are there groups that provide, because, this, the whole food insecurity issue is becoming very real.
Right.
Where can you go to help people?
Breathe Strong CF does that. Like, there are so many pockets for all of us, right?
Yeah.
And I also have to say, Jason always brings me back to center on this, because Jason, you always say we're just doing what we're doing. We're doing what we're supposed to do and keep moving forward. And I love and appreciate that. I think it's important just to, hey, we're doing this. Mm-hmm. And, you can't control all the other things that happened. So,
well, Mike was talking about the matrix that he's working on with the team at UAB. I've got two daughters who will need something to do this summer. So I told them I would give them a shout out on this podcast. So shout out to Riley and Avery. But
yay.
I'm thinking about having to add a map above my dry erase board there, and I'm going to get some sort of color-coded pin system similar to what you do when you visit different states, and then take Mike's matrix and try to make sense of a very nonsensical situation, which is, he touched on a couple there. New York, you touched on Michigan. We had a call from Washington State, a group up there who sees patients from 4 regional states: Washington, Oregon, Idaho, and Montana, none of whom's Medicaid cover vitamins. And so if I've got green pens and red pens, green for those that do and red that those that don't, I got a sinking suspicion I'm going to have a lot of red pens up there. But not to let anybody off the hook, I think even the folks at the highest levels of CF are still trying to weave that fabric together.
Mm-hmm.
Mike's right. It's a very, very non-static situation. Mike's worked on a letter that we're planning on sending out to a lot of the centers in New York to say, look, are you aware of this change? Are you preparing for this change? If so, let us talk to you a little bit about the patient assistance program so that you at least have a low cost, and perhaps if other donors step to the line, a no cost alternative for the loss of these vitamins. So it's complicated. It is certainly not something, like Mike said, that I see getting any less complicated, at least in the rest of this calendar year. But again, you mentioned several. Emily's Entourage is another. There's just so many great groups.
So many.
What Gunnar and his team are doing at the Esiason Foundation, it's just
Inspiring.
I'm very hopeful. I'm very, very hopeful. But you're right. We are all having to paddle against a very, very strong current.
Well, and Jason, and you can share the company because actually you're the one that identified the relationship. But we've got a local company, so here in Huntsville, Alabama, that's involved in propulsion and the space industry. And Jason, I think through a friend, one, you identified that there are a large donor in supporting cystic fibrosis.
That's right.
And what struck me was, through all of this. Through this challenging time, we've gotten better. We've all gotten better at finding alternate resources, making new relationships, building bridges. And Jason, what's the name of that company here in town?
It's Blue Halo. Blue Halo is a very well-known propulsion company, and they recently, I think it's called the Rising Star Award. It's a CF Foundation acknowledgement that as a company they are doing a lot for CF research. And so I'm like you, Laura. I've got no shame. I will.
Right.
I've already called and asked for a lunch and utilized the connective people that we have in our lives. We even connected them to a local family here in town who we support through their Great Strides initiatives at the walk every year. And so the ask has not been made yet, but it is inevitable. We will be asking to see if they have any interest in patient assistance, whether that be, through offsetting the cost of vitamins or something else. But yeah, there's too much connective tissue not to try to see what's there. But yeah.
Well, I always say jokingly, in Laura, in what you do, right? In what we do, we're used to hearing no's.
Yeah.
And occasionally you get a yes, or maybe it's not today, but we'll think about it. You've got to start that journey of reaching out and building relationship and building bridges and not feel bad about the no's. Because if you ask enough, you're going to get the yeses.
And if I may, Laura, the last thing I'll touch on this particular topic is we had to condition a lot of our staff to say no for the first time ever.
Yeah.
Right? Like we talk about how we start at a yes and often stay at a yes. But because of the scope and scale of what had happened with the loss of these funds, we had for the first time ever to say no to a lot of things. And it was us trying to be good stewards of our staff and their well-being and their, they all have a heart similar to Mike and I. And so we had never been in the business of telling people no. No, I'm sorry, we can't send you this, or no, we can't do that. But let's tell you about PAP because it's a way that perhaps keeps us around, right? If we said no, if we said yes to all the questions that we've had in just the last 4 months, our financial statements wouldn't be too pretty. But it was a difficult thing to hear for a lot of our staff, but it solidified the importance of what we're doing. For them to hear from me or to hear from Mike, if you're not well today, right, because you've had to tell a family that needs help, that, hey, we can't send you 3 bottles, maybe we can send you 1. Or, I'm sorry, we just checked your grant and it's expired. Let us send you 1 for 30 days while you kind of figure out your next steps. Yes, those are yeses, but they're very temporary yeses. And we know that if we're going to be who we say we want to be as a company, how we say no is just as important as how we say yes. The empathy behind it, we have to be able to put ourselves in their shoes as best we can, right? So those have been tough, right? I've had people knock on my door and I can just tell, like, they got off a tough phone call, right? Somebody that maybe has a difficult immigration situation, right? There's really no outlet for them. How do we help those folks? It's just
endless. There's so much need.
sure.
And we have a great friendship and a great partnership. And I know the podcast got a little bit delayed in recording because we had some microphone issues, but we do have to wrap it up. And I hope that I see you both at the NACFC.
Absolutely.
Because that's always a great time. But what else, Mike, did you want to talk about before we wrap up here? And then Jason, I'll get your thoughts as well.
Sure.
So, I mean, if there's one thing that I would add, it is an invitation to any social worker, any dietitian, to reach out to Jason, to reach out to me so that we can brainstorm about how they might take a very active and positive role in seeking local donors. I mean, much like we've talked about Judy Fulton out in Aurora. It's new to them. And I know when something's new, it's a little scary. It's tough to take that first step. But I would encourage them to reach out to Jason, reach out to me. Let us share the successes because they're varied. Let us share with them it's okay to be a little scared. But let us also share just the sheer delight when they're able to do something that they couldn't do before, and the incredible impact that has on the families that they provide care for.
And we'll put all that information in show notes too, so people can get a hold of you. But Jason, please go ahead.
Hang in there. I mean, I'll take Mike's eloquent statement and put it down to a bumper sticker level. Just hang in there. Like the cat in a tree posters that you used to get or your kids used to get when they would go to the book fair, right? My kids are that age. So, I mean, the thing that I would say is, I don't know if you can see it. I kind of sat to the side throughout this entire call so I could kind of highlight the board behind me. But, I got a board in my office a few years ago thinking I'm going to be really mindful about taking notes and crafting out my initiatives and my thoughts. And it became really just a giant magnetized piece of metal for me to hang all of the thank you cards and things that we receive that help reaffirm, not that we need a lot of reaffirmation, but help reaffirm that we are doing the right things. I'm sure there's one up there from you. I'm sure there's one up there from Emily. But I often eat lunch in my office and my chair swivels and I'll kind of spin around and look at it. But as long as I keep having to find places to put those things up there, I have had to it's become almost like a game to move them around and find enough for wall space. As long as that's a problem for me, I think we're doing the right thing as a company.
Mm-hmm.
I like you, carry a degree of hope towards the future, towards a day where we can get back to a sense of normalcy. But I'm also like Mike when he says things like, we've honed our senses a little bit better throughout the first quarter of 2025, right? We now know more about the questions we should be asking, whether they're Medicaid in your state related. Do you have a family organization that supports your center that we could potentially be connected to? And these aren't things that are exclusive to PAP. These are things that, relationships that we would like to build for the day when PAP is maybe something that we look back at as a success, but something that the circumstances suggested we didn't have to do beyond 2025, right? So we're going to keep doing that. We're going to keep building relationships. I'm going to keep finding new and creative ways to display those thank you cards up on the board because I truly believe that's what MVW is built upon. And as long as I'm around, that's what we're going to continue to do.
Well, thank you both, because I'm so glad we're friends and we're all part of the CF community. And I admire you both, and I appreciate all your knowledge and helping me and, passing it on or saying, hey, think about it this way, or I really appreciate all the feedback. So thank you both we're really lucky to have you. So thank you.
And Laura, we're so lucky to have you. Thank you.
Ditto.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Vertex Pharmaceutical, The Science of Possibility, and Viatris. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.